As we talked about, the Whipple procedure, also called pancreaticoduodenectomy, is a very detailed surgery. That's because we need to remove the head of the pancreas. The head of the pancreas shares a delicate connection with the duodenum, which is the first part of the small intestine, as well as the bile duct. The bile duct is a small tube that carries bile made in the liver into the first part of the intestine. Commonly, a tumor located at the head of the pancreas can block the bile duct. When this happens, bile flows back into the liver, gets absorbed into the blood, and causes jaundice to develop, or what we know as the yellow discoloration of the skin. At the same time, the stool may appear clay-colored, because the bile that normally gives stool its brown color no longer reaches the intestine. Along with the head of the pancreas, part of the intestine, and the bile duct, the gallbladder is also removed. This is because the duodenum produces hormones that help the gallbladder work properly. When the duodenum is taken out, its helpful hormones disappear, and the gallbladder loses its support. Removing nearby organs can also disturb its blood supply, leaving it at risk of poor circulation and becoming unwell. The gallbladder is removed during the same surgery, and in most cases, this doesn't cause any significant consequences for the patient, especially considering the other organs that have already been taken out. Reconstruction is done by bringing all the remaining parts back together. If we divide the pancreas, let's call that section A, and then divide the bile duct, which we'll call B. We separate the intestine, which we'll call part C. After removing everything, we're left with three main pieces. The pancreas as A, the bile duct as B, and the intestine as C. We took out the whole central part. The stomach was also divided, just past its valve, at the first part of the duodenum. That portion is what we'll call D. In many cases, it's possible to preserve the entire stomach, which is often helpful for recovery and function. But sometimes, depending on where the tumor is located, we're unable to do that. In those situations, part of the stomach must be removed along with the rest of the specimen. So how is reconstruction done? The intestine is the most flexible part. It can be moved and reshaped. That's why we carefully flip it, bringing it close to the pancreas and bile duct. In this drawing, we've flipped the intestine. The end we call C is now positioned here, close to the pancreas. By connecting them, the pancreatic juices are able to flow back into the intestine. Farther down the intestine, the bile duct is gently reconnected. This allows bile to flow back into the intestine once again. Further downstream, the stomach is reconnected to the intestine. This allows food to re-enter the alimentary system and continue its journey through digestion. In the end, food goes into the stomach, then into the intestine. Pancreatic juice and bile also enter the intestine here. Everything comes together, and the body returns to normal.